Yeah, so I think the last time there was a strike of this, like I said, was Ronald Reagan was an actor.
Hmm.
And so it had to be before the 80s. So I'm thinking it was 60s or 70s. But I feel like we have a whole different set of issues now. And this is a lot more in depth than that probably was.
Hmm. And to put it into perspective too, because I'm thinking about disparities, and when we link it to disparities in healthcare, and then not only from an ethnic standpoint, but even in roles in terms of nurses and how we're represented. Chadwick Boseman, when he died, he had an alleged net worth of 4 million, and per IMDb, he was able to get 5 million of residuals from Black Panther. So that shows that he was able to negotiate it. Because I was trying to see. He had a very strong catalog coming in. He had played Jackie Robinson, James Brown, Thurgood Marshall, Ernie Davis, who was the first African American to win the Heisman Trophy. So he was coming into Black Panther with a very strong filmography. So I'm still curious on who's able to negotiate for residuals versus like a new grad. Like a new grad, you're not
Right,
coming in working days. You got to do
right,
your time
right.
nights. But when you look at the difference, so somebody like Chadwick Boseman, with again his whole history here of his filmography, and dying with a net worth of 4 million, that generational wealth and how it's distributed, it's very limited there when we looking at the strike and just kind of this industry as a whole. And one thing
Mhm.
that Roy Wood Jr. was saying, that he feels like there's a public disconnect, which you mentioned, Lisa, to distinguish between working actors. So those well-known actors that we know that you had mentioned that were donating to the cause, and we've seen like Jane Fonda out on the why am I drawing a blank? Out on the
The picket
sidewalk
line,
with people.
the picket line.
Thank you. Out on the picket lines with the people. But we see these well-known actors that we know that they're making money, but the remainder of the industry, which is 95%, their median income is 60,000. And you have to earn 26,000 to qualify for healthcare coverage, and that's per SAG. So 60,000, especially here in California, that's in my mind poverty level.
Mhm. Yeah, it's I mean, just think you have to earn 26,000. I mean, I I can just imagine some of those. I mean, well, that's why you see a lot of actors and actresses that are, waitressing on the side because they
Yeah.
just can't make it.
And during Biden, when he was giving out, no, it actually started with Trump and the COVID reliefs that they were giving for rental assistance and food. And people were getting angry about that, saying, why? Well, because of actors. If you're making $60,000 a year, and let's just say you even have a family of four, your rent could be upwards of $3,000.
Yeah.
I'd say average of four.
Yeah.
So that alone. So how are people supposed to eat? And then when you're talking about healthcare coverage, like no, there should be some reprieve, and people should be able to access money during COVID, especially because the industry was shut down.
It
Like
was
that
shut
whole
down. Yeah.
entertainment industry is similar to now. And a point with that is not only like when we have the studios that are in Hollywood and that are in Burbank, there is a network of businesses that surround these studios that support them, even if you think of catering. So all of that is shut down. And like in Hollywood, Roscoe's is right across the street from the studios. But now if they're shut down, they've said that this is lost revenue for them. And even the
Yeah,
street vendors.
all the restaurant businesses were shut down. So it really hit the restaurant workers, the restaurant industry too. I mean, I knew plenty of people that just did not go to work.
Yeah.
and
So it has
and I
tentacles.
was so well, but I was so grateful us in the healthcare field. It was a lot going on. We were stressed out, but we never felt that because we kept working.
Mm-hmm.
And so it's hard for some people to understand because you just need to go do Zoom meetings. There's some people that are actually people that work in the industry that are servers. They can't serve, I mean, and do Zoom meetings. We were able to transition a lot of things into Zoom and remote and things like that, where it just doesn't happen with others. And so I'm really grateful that I just didn't feel that. I didn't feel that.
Mm-hmm.
But so many people did.
Lisa, how do you feel about AI? and artificial intelligence in healthcare? I guess in general and in healthcare.
It's a little scary to me.
Mm-hmm.
I would have to see more research, more outcomes, more data over the next like 3 years before I would really feel comfortable.
Do y'all have those robots that has the doctor to where your doctor can zoom in?
Yes.
Have you
I've
seen that?
well, I haven't seen it since I'm in the hospice. We don't have anything like that, but I know some of the hospitals do. And I think it's great. It saves time. It's accurate from what I see. I even see the new robots doing people's eyelashes and nails. I've seen that on
What?
TV. Yeah, it's in California. You should
Seriously?
know. Yeah, it's in California. You go in for manicure. They're called Express, and you put your hands in, and it's like a 10-minute thing. And the eyelashes, they're people that want to do eyelash. You lay there, and a robot's putting each one on
Are you
accurately.
serious?
Yeah, you have to look YouTube that.
I will.
It's out in California. It's actually started.
I don't know how I feel about that.
Yeah, I
I don't
I don't
know.
know how I feel about it's too new for me to feel just
Mm-hmm.
yet.
Mm-hmm.
Like I just there's a level of trust that I would have to have from seeing it happen over and over and over and seeing the statistics and the outcomes. And I just don't have that yet. It's too
It,
new.
I'm with you.
I don't know what the margin of error is. I mean, like how many times does a robot make a mistake? I don't
And what
know.
kind of mistake? What is that complication? Absolutely, because that's like
Yeah.
me and LASIK. LASIK was out for almost 2 decades before I went and had it, and we worked across from that eye institute, and they were doing it all
Yeah.
the time. But I'm like,
Yeah.
let it be out here for a minute. And I should have did that with my Invisalign, but I didn't, and it actually gave me TMJ, which is not a diagnosis anymore, but it was what it was. I felt like I was having a stroke, and I wish
Oh,
I had waited because the technology was too new. But
yeah.
what you're saying there, I'm with you. I don't know how I feel about AI because even with the robots, and I saw something on social media talking about an AI nurse, and I didn't even click on it because I'm like, that just doesn't make sense to me. But what we had at the organization that I worked at, it was actually our doctor, but he was coming in with the robot, so kind of remote, but it was actually him giving the knowledge versus inputting a diagnosis into a database, and then they're pulling up an algorithm for treatment. But what this comedian was saying was that AI is now a gateway to automation in other industries, as you noted here. And if we think about self-checkout lanes, like I have my second mom, she doesn't go to self-checkout, she said, because you're taking a job away from somebody. And I'm like, yeah, that's true. But Bakari was saying that it's a race to the future. And so Mr. Wood said that it can be the future, but how do we as workers, what is our input in constructing together what the future looks like? And we can absolutely draw that line in healthcare when we're thinking about it being a dynamic environment and changes in our workflow and what's expected of us, our scope of practice, and what input do we have in those changes that we know are coming.
Yeah. Yeah.
Yeah.
I mean, there's a lot to me of just wait and see. Sometimes things just take time,
Mm-hmm.
and we know it's coming. It's here. It's here.
Mm-hmm.
AI is here. But we have to really do that research. There's got to be the research done, the outcomes, the statistics, the data, so that we can say, okay, out of 1,000, surgeries, there were only 2 that had this complication, and the complication was this. Was it serious? Was it, we're just not there yet. To me, we're not there yet to be making these kind of decisions when it comes to nursing, for sure. We're not even close.
Yeah, and definitely for nurses, and you'll touch on this in terms of unions with healthcare, but most of us in nursing, we're connected to strong unions and have a fair amount of autonomy over our work and what that looks like. But with these studios, the work and what the future looks like is being guided by executives. And just to give a little example, so over the past 5 years, the heads of entertainment in Warner Brothers, Fox, Netflix, Disney, Paramount, and Comcast made over 5 years. They made anywhere between 152 million to 498 million dollars. And when I Googled industries that are striking or contemplating strike. I saw here that UPS, and I remember when that was happening, under Teamsters, which is a very strong union, they were negotiating for their workers. And some of the points was installing air conditioner into more trucks. We had a young man out here that was driving, it was either a UPS or a FedEx truck, and this triple digit heat. I want to say it was last year, and he died, a young man. There was no air conditioner in that vehicle. Eliminating two-tier wage systems for weekend workers who are getting paid less. Like, that's crazy for us as nurses. Weekend nights, we get more. But for UPS, no. And then pay for part-time workers. They were negotiating for $2.75 more an hour. And then over the period of a 5-year contract, $7.50 more. So for our workers, majority of whom are part-time, and what comes into my mind is now the availability of healthcare benefits. We're talking about $7.50 over 5 years, whereas your C-suite people, your heads, are making anywhere between 152 million to 498 million. But then people say there's no money to give you what you want.
That seems to be across the nation. There's the CEOs, they're going to get paid. They're going to get their money.
Yeah.
So there's money there somewhere. It's a matter of where they want to put it.
The money is there.
The money's there. It's a matter of how we want to distribute it. And until, I think that in that part, the union is much needed, because I mean, we have to be able to have a voice. People have to stand up and fight. And it's not, I mean, you're fighting to just live with the inflation, with what the cost of living is. People are fighting to just make it. No one's out here fighting for several billions of dollars. They're fighting for raise increases for them to just be able to make it in life and be comfortable, where they're over here with the top, 3% of the world, living miraculous lives with private jets and everything, but we don't have the money to do this. The money is there. It's just anyone that can follow a paper trail will see where the money is. It's just a matter of where is the money going to be distributed.
Lisa, so I'm going to make 3 more points, and then I'm going to kind of segue it over to you. But this podcast, I would encourage everybody to go listen to, because one of the things that he brought up in terms of actors, and this is what he was saying under the umbrella of what the public may not be considering. He was saying that the rate of episodes, he said back in the day for a TV show, you may have 20 episodes. But when you think of somebody like Tyler Perry, his business model is to turn things over so quickly. So what used to be 20 episodes is now 8. So that's loss of income. And then he gave the example of Martin, to where we had those 5 cast members. Whenever we turned on Martin, we were guaranteed to see all 5 of them. But now what they're doing is they'll have Martin and they'll have Gina, but they're telling Pam, Tommy, and Cole, you're not going to be used in all episodes, but because you are first call, you need to be on call, essentially. So you can't go work anywhere else because you're first call. And if they call you, this is your main gig, you have to show up. But now it's limiting their income in terms of you're not guaranteed to be in, even if it's the 8th episode, you may not be in all 8, but you still have to be available. And I was like, that was absolutely ridiculous. And one of the questions that he said is, what is a fair wage for Americans? Kind of what you were saying. And for me, I was thinking about it like, that can't be a static wage, because at the age of 48, I can't be making what I was making at 18. Like, that doesn't absolutely make any sense. But it seems like those who are heads of industries are completely comfortable with that. And when I was looking at industries that, again, were striking, whether it's the hotel industry, which is actively striking out here in California, and it just got violent, the news reported yesterday. It's globally, the brain drain that's happening among Nigerian doctors who are going to England, who themselves over in England, the physicians are striking. Physicians are forming unions. That's another thing. And then LAUSD this year, our teachers went out on strike. Some of the commonality is wages, improved healthcare coverage, meaning what are we covering? The provider networks in terms of the quality of care. And then also too, the premiums, like for the corporations to bear more of the costs of that. And then the strenuous workloads and it was like this BNSF trained engineers. They wanted a predictable schedule and to be able to use sick time. And they were given 8 days of sick time. And Congress had to force the industry to do that. So just kind of 3 takeaways that I could go on and on here, but I'm in the interest of time. 3 takeaways that made the healthcare connection for me was 1, autonomy over your profession, your trade, your intellectual property, and your craft. What does that look like? These stagnant wages that, again, our leaders seem completely comfortable keeping us at minimum wage. And the fact that we are literally working people to death, yeah, that are having to take 3, 4 jobs just to make what should be one.
Absolutely. Absolutely. Nurses, I rarely find a nurse who has one job. They have a primary job. Yeah.
Right.
But they have their main job, and then they have a side job, a PRN job, an extra job. And the people that are in the higher up levels, are comfortable, but the nurses still have to do what they got to do to make ends meet.
Mm-hmm. Yeah. So nursing unions, the need.
All right. So yeah, we're going to just talk about nursing unions, just pros and cons. But when you think about the nursing union, I have never been a part of a nursing union. I've never worked anywhere that there was one, but I see here in town, KU, HCA, different places. And I think to myself, wow, that would be so great, especially when we all are feeling something so strong to have that voice, So when I was looking at the unions, the pros to it, basically one of them is ensuring the safe work conditions. This is staffing levels, adequate breaks, equipment that's safe, protection from violence and harassment. Those are all really important things. Staffing levels, I'll just go back to that. That has been an issue from the beginning of my career till now, of staffing. That is the biggest issue. Mm-hmm. And we know as nurses that sometimes we're put in situations where it's just not safe. We are expected to monitor patients with such a high acuity level, but there's not the staff to do it. And when things go wrong, we're going to take the blame for that. We are going to take the blame for what went wrong if that patient was under our care. So if we do not have the adequate staffing levels, that's setting us up for failure. And that's where, to me, having a union to fight for staffing that would be one of my biggest pros. Mm-hmm. That would be one of them. Advocate for better pay. It says, according to the U.S. Bureau of Labor Statistics, healthcare workers, not just nurses, who are union members, earn an average of $1,380 weekly compared to $1,200 for those who are not represented by a union. And that's just the average over the U.S. Honestly, that varies so much by what area you live in. Because if you're in a rural area in Arkansas, you're not making the same as LA or New York City, but you can see that if you have a union behind you, you're going to be making better wages. I can tell from the hospitals in town here, they are making better wages. Mm-hmm. And that's just a absolute. That's going to happen. Mm-hmm. They also negotiate for like bonuses and bi-yearly raises, and they keep up with the benchmarks that are nationwide to make sure it's fair, and mm-hmm. they're going to fight for that. They also ensure due process for discipline. Nursing unions, they establish a process when there are nurses facing disciplinary charges. They have guidelines where a nurse cannot be terminated or disciplined unfairly or inconsistently. So they're going to make sure that if a nurse is being terminated or is being written up or any kind of discipline, that it's for a good reason. It's not some of the other reasons that, we feel are not fair, because all of us know when you're not working in a union, if someone, let's say you and your boss don't get along, sometimes there's a way for them to make the case that you're just not a good fit. Mm-hmm. So a union's going to make sure that all of that is documented. Why are you not a good fit? What did you do?
That
you know.
accountability. Mm-hmm.
Yes, and I think that that is really important.
Yes.
They also verify that the same rules apply when you're hiring, promoting, or terminating. So employees know what to expect. Everyone's held to the same standards.
Yes.
Um, you're not just able to hire your best friend because she's a nurse when you've got three other applicants that may be more qualified. So that's important. Investigating grievances. Nurses who raise a complaint with management do not have to do so on their own. They can call for their nurses union to investigate and act on that if they have cause for the complaint. Some unions will supply an attorney. It provides the nurses with valuable support, so they don't feel like they are going in this all alone. You know, they have some backup and support.
Yes.
It's very intimidating to go in and raise an issue with upper management or HR all by yourself. You know,
Lisa,
it's
can I tell you really quickly, because
sure.
you just stimulated. When I worked at so I'm still with the organization and a different campus, and we had a manager that was horrible. I mean, when I just she was extremely horrible, and she would pit colleagues one against the other. And so now I'm telling my business, which is my right to tell. She called me in the office at about noon, and she was telling me that that I didn't address a patient who was hypertensive. And I said, "What do you mean?" She said, "Well, so your nurses are telling me that you didn't administer medication to a patient that was hypertensive." She said, "You do know what hypertension is, don't you?" And I said, "So and so." I said, "I've been a nurse for X amount of years. I was a dialysis nurse, and one of the main causes of kidney failure is high blood pressure. So I am absolutely able to spot what high blood pressure is." And I said, "Who is this person that allowed me to give them report and did not hold me accountable for not addressing the hypertensive episode?" She didn't tell me. And her goal was to have me shook, but she didn't know who she was dealing with, because it was nurses that were on the unit that she would pull in, like I said, midday, critical care, and would just kind of decimate them. And they would come out to the unit crying. People were having to go in and to console them. Long story short, we escalated it we brought it to the union, and we were meeting with nursing executive level leadership. Do you know that these people knew how this woman was behaving? And they said we were coaching and we were training her behind the scenes. I said, but when you saw that it wasn't working, at what point, if we did not have that union to come in and advocate for us, because we were months complaining to executive level leadership saying that this manager is not safe. She's not good. She's destroyed the morale of the unit. It went on for almost a year. And I said, I was the only one that spoke up at that meeting. They opened that door, and then others started chiming in. But I said, because I was offended, because I told her, I said, she would pick with me, and she had her little henchmen that would come around and would do it. And I tell you, it was one time that she had her nursing, that nurse on me, that if she had been there that day, I probably would have been fired, because I was prepared to get physical with her on stuff that they were doing, and just making lies and making incident reports. Lisa, how many incident reports did we do at Truman on colleagues?
I don't remember any.
Thank you.
One. That Hespan and heparin thing.
And how many years were we there? Lisa, they was doing incident reports. It was no less than 3 or 4 incident reports going every shift on colleagues. And I said, what's wrong with you people? And what kind of culture are we setting up here? But this was the manager. And I told her, the only thing that got her off of me, I said, because she would say to me, "I don't know how you'll do in court. I don't know how you do in court." And I sent her an email. I said, "That very court that you worried about me," I said, "I'm going to see you in it for discrimination and harassment if you keep on." And I listed all the people that she had coming for me. And I said, "Keep it up." I said, because I got a paper trail, but it was the union that had to step in to get that woman out. Us saying it was not enough.
Yeah, and that's the thing, is those unions can be so powerful. And I wish I would have ever experienced working with one. You know what I mean? Because I've definitely had situations before that it could have been beneficial.
Yeah.
So, going into the cons of a union, you know, I think basically one of them is there's union fees. The nurses have to pay. It usually comes out of your paycheck. For me, it's worth it that's not a big con to me. I mean, it's worth it to have a representative and have that support. I'm all for that. Union fees or not, I'm okay with that. Unpaid strikes. Strikes are a union's most powerful action, but they carry a cost because striking nurses aren't paid. Some nurses may not support the reason why they're going on strike. So if you think, I don't have a problem with that, but collectively the union is wanting to go on strike, you're going to have to, and you're not paid. So it's, and we all know kind of like when nurses get paid like triple the amount to cross the strike lines, and we're all standing out there side-eyeing these nurses, but they're coming in and taking the opportunity to make the money.
Yes.
If you feel that this was a valid reason, then I think it's great, because you're not going to get paid. You're gonna support the strike, and hopefully it doesn't last that long. Usually with nurses, I don't see it lasting as long as some of the other fields. I feel like we've got to have healthcare, we've got to have nurses. They're really motivated on both sides to try to get this fixed.
Yes.
But it would be kind of issue if it was something that I didn't think was an issue, but I have to lose my money over it. But that's, I guess, one of the downfalls of it. There's pros and cons, right?
Mm-hmm. Lisa, to me, this is where the collective bargaining comes in, because I hear a lot of that with unions, to say nurses, and even for us, we're in a dual nurse and social work colleague. And if a person doesn't feel that that issue is relevant for them, like they don't want anything to do with any kind of strike or action around it. And I can see where it does weaken the union, but it's called collective bargaining for a reason. And if we go back to David Schwimmer, David Schwimmer has said, listen, I'm the star of this thing. Y'all in my world, I can get $1 million. Y'all better go negotiate and get what y'all want. In the end, look at how that would have played out for him at the end. So to where, again, there's enough money, like you said, the money's out. So there's enough money for everybody to get a piece of the pie. And there's enough money for us to hold these organizations accountable. But it takes all of us together, whether the issue affects me or not. What's the agenda?
Right. And the thing about it is, the way I was looking at it, like, if this doesn't affect me at all, but I have to lose my money, maybe next year the issue will affect me. And I want them to support me too. So that's why I'm here. And that's why you support. That's why you're in it.
Yes.
Another one of the cons is seniority gives, according to many of the nursing union contracts, promotions and raises are based on seniority.
Okay.
And the person who has worked the longest gets the first chances at a promotion, larger raise. Many hospitals and unions will have an advanced ladder that factors education, certificates, and years of experience. Seniority is objective and easy to measure. However, when seniority is the most important factor in promotions, stellar performers receive the same rewards as those as adequate. So if let's say I just started 5 years ago, and I am like going above and beyond, doing everything, and someone's been there 20 years and she's doing the same, she's going to get the raise, the promotion, and probably should, right, for her time and effort. But I am going to be looked at as the rest. That I'm not up there. You know what I mean? So it's a little bit different, because you have to, not only do you have to work on your performance and be above and beyond the best, but that over and over again for years and years and years to have that really raise and promotion. So in non-union companies, I've seen people come in, shown who they are, and got immediately promoted.
Yes.
That's not going to happen in a union, because if someone's been there 20 years and they're doing a good job, they're going to get the promotion.
Okay, that's a good distinction.
It says can protect nurses over patients. Unions are designed to protect nurses rather than patients, which can negatively impact patient care. For example, unions make it difficult to terminate nurses, which may empower nurses who perform poorly. We need to think about that, because as a patient, and we're to advocate for the patients. We're patient advocates, that they should be getting the best care. If there is a nurse performing at a very low level not giving that patient care, because there is a union, there's going to be several steps that have to happen before that nurse is terminated. So you may in turn have a nurse who's not giving the best patient care on your unit for a lot longer than you would have if it was non-union. Just because everybody's got to get that fair investigation steps. I mean, it could be completely obvious to everybody who's working there.
Yes.
But everybody has to be treated the same. Everyone has to have that investigation off, they get the support until they have the proof. Yes. So you can look at that as a pros if you're the employee, but if you're not a good employee and you're doing things that are not right, and to me, it crosses the line when it comes to, are you doing something that is dangerous? Are you doing something that can harm?
Yes.
At that point, I feel like it should be immediate. You're doing something that can harm. It should never happen again. So when you have to go through this investigation with the union and prove it and all of this, it takes time, and you're just hoping that nobody gets harmed in the meantime.
And Lisa, as you're talking, I'm thinking of two different things, because, and check me if I'm wrong, remember we worked on our unit, we worked with a nurse. So how do we tease out ageism? Because we worked with a nurse, and I recall her being very competent, but I recall her being slow. Remember, you know who I'm talking about? And I recalled her being slow. But what you're speaking to here is, like you're saying, harm. People, practitioners who are just doing kind of these egregious things, to where it's like, okay, you're putting people at risk. And I think I have seen that, to where the union is now advocating for them, because I'm like, who are y'all talking to? Like, which colleagues are y'all talking to where this person is still working, separate from ageism?
Yes. It's to me, it's really, it's about, are you causing harm? Are you not fulfilling your job duty up to the highest level? Or are you doing something that's negligent and causing harm? I mean, there's two different things. Like, if you're causing harm, and this, I just feel, to me, that just should be, no, that's just done. So, but it's one of the things with you. So those are all the pros and cons.
Okay.
With the unions. So, I think it's, to me, there's more pros than cons. I definitely would support a union. But I mean, it would be something that I would look into each organization that I was going to be a member of. I'd really want to look into, the bylaws and all these things, because it makes sense to have that fairness. But, as we all know, there's some nurses who take advantage of that. They know that they're going to have support. They know that people aren't going to be able to touch them without going through the union. So they don't have the work ethic that's the same as those of us that are here for the right reasons.
Yes.
So we just have to all look at that.
Yeah. And you know what? I agree with you. And I think that I've always, with the exception of being in Kansas City, upon my arrival to California, I've always been a part of the union. The organizations have, and California Nurses Association is the union out here, and it's a very strong union. And in terms of them dues, it's almost like mandatory, to where people are looking at you if you crazy, if you don't. And they're very strong. Like, we have unit reps, and with CNA, those unit reps are very strong, knowledgeable of the policies and in terms of recruitment and what's going on. So to where I've never known a nurse to not be a part of CNA, whereas the union that I'm with now, they're struggling on that for both the nurses who are case managers and social workers to join the union, for all of the cons that you mentioned. But I think that, especially given all of the industries and the complaints of wages not being worked to death, healthcare, predictable schedules, basic things of installing air conditioning, and for us to be able to have breaks. And, how long do we give people breaks within a certain amount of periods, and what you're entitled to? And that stagnant wage, like that's so offensive to me. And even as a professional in my role, my wage with the union that I'm in right now, which is they're a good union, but they're trying to kind of strengthen themselves. It's about a $18 an hour differential. if I was with CNA. That's huge. And even though my pay within this union has increased over the years and they've been able to bargain, where they're able to get maybe $1.25 here, 70, not 75 cents, but, a couple of dollars here and there.
Okay.
Nurses under CNA, they're getting, $7, $8 an hour differentials, $5 an hour increases, something substantial to where you can feel.
Right.
And I feel like what we're seeing in the entertainment industry and all these other industries, I don't trust, the leaders of that industry to do the right thing by workers. They historically haven't proven it. So I don't know. I don't trust them to do that.
No. And it's sad. It's sad that people will expect so much wealth and get accustomed to that lifestyle and not want to take any kind of cuts to have other people live. You know what I mean? Live, just live, just make
Live.
it. And there's no humanity.
That part.
There's no humanity. And that's sad to me. That's sad that this is the way the world is.
Mm-hmm.
I know if I can't ever say because I've never been a multi-billion-dollar, owner of anything, owned an NBA team or CEO of a hospital or whatever. But I would hope that I would have some humanity to where I could, okay, maybe I could take this much of a cut and distribute it more. I would hope that I don't know, because you don't know what you're going to change into, right? I would
No,
hope
Lisa, so
that.
I'm going to speak for you. I'm gonna speak for you because I've known you almost 30 years. No, I'm
Yeah.
gonna speak for you to say no. I know that you absolutely would, because even the kind of manager that you are right now and how you advocate, people become managers and their focus changes. That didn't happen to me when I became a manager. I still advocated for my team, and just discussions that we've had, you still advocate for your team. So you are the person of who you are. You just now have more resources. And the point that you're making, yes, as you know, for us, if we're content creators and we're building something, of course, we're going to get a bigger share of the pie. But now that doesn't mean that I should look and see my workers going hungry. Remember when we worked for the agency? Like,
Yes.
we weren't going hungry. Like, we were being compensated for the work that we did.
Right. Yeah. And I mean, so to me, the takeaway from the whole union thing is just there's a balance. I feel like we have to have strong representation. We have to have support. Everybody has to have support to get where they need to be. Fairly, breaks, pay, all of that. And then, the cons of it are there's always going to be bad people trickling through anything that's positive. Anything that's positive. When they were giving the COVID relief, how many people committed fraud?
Right.
You had all those people that needed it, and then there's people committing fraud.
Yes.
But so you've got people who are going to take advantage of the fact that they're in a union, and they're going to have to prove this, and I'm going to keep, doing whatever. But for the majority of us that are doing the right thing, we can't let that stop us from being a collective unit and trying to stand up and make a difference for everyone. So even if there's bad people involved, that's just it's gonna happen no matter what.
I agree with you. And then on political advocacy too, which we can talk later, but how do we now own the voice of what we're doing? And that comes through policy. And so who's creating those policies? Is it the workers that are doing the work, or our C-suite or executive level leadership? But yeah, excellent point you brought up today. So really good discussion. We look forward to seeing what people say in the comments.
Yes. Everybody, nurses out there, union or not, chime in on it.
Yeah. Okay. Well, Lisa, thank you for another wonderful episode of the Two Bad Nurses podcast. And we will tap in and see each other and our viewers later.
All righty.
Okay.
Bye-bye.
Bye.